we're so glad that you were able to join us today for our topic on dementia care options. So before I introduce our speaker, just to give you a little bit about ElderHelp and why we do these types of webinars. So our mission at ElderHelp is really to support older adults and their desire to age in place successfully in their own home. And that doesn't come with just the older adults, it often involves the family. So we have been supporting the San Diego community for over 48 years. And while we provide direct services to older adults, we also provide support and resources to family members who might be caring for an aging loved one. The core services that we provide at ElderHelp include information and referrals, so connecting people with resources. We also offer check-in calls through our Are You OK program. We have transportation that's offered through Seniors A Go-Go and done by volunteer drivers. Our care coordination program involves social workers as well as volunteer services. And we offer housing support through our home share program and housing navigation resources. In addition, we have a family caregiver support program, and that's where these webinars are through. So our goal is to educate family members on what it means to be a family caregiver, but for us to provide resources throughout that journey. Everybody's journey looks a little bit different, and so some of you joining today might be providing day-to-day care for your loved one, and others you might be looking for what lies ahead and how to plan for the future. And so wherever you are in that journey, we think you'll find the information from today's topic especially helpful. I want to give a special thank you to Northwestern Mutual for sponsoring today's webinar and for being a partner in purpose throughout this past year. We appreciate that very much. And it is now with great honor that I am able to introduce our speaker for today's topic. So we partner with Alzheimer's San Diego in a variety of ways, and we are very appreciative of their expertise in dementia care. And so we look forward to hearing from Jean today. Let me tell you a little bit about Jean first, though. So Jean Alton has worked in the field of Alzheimer's disease and related dementias for over 30 years. She has a bachelor's degree in psychology and in recreation therapy, and is a certified positive approach to care dementia trainer. Jean's expertise is built upon her many years of experience working in a variety of settings, including memory care and facilities, adult social day programs, early memory loss programs, and care management. Jean is a senior dementia educator with Alzheimer's San Diego, where she provides community education and coordinates programs for people with early stage dementia. So I think it's obvious that Jean has a lot of experience and will be able to shed some light and share her expertise with us today. So welcome, Jean. We're so happy to have you.
Thank you, Carrie, and good morning, everybody. Am I getting a little bit of an echo?
You know, I'm gonna go ahead and mute myself to hopefully avoid some of that. And before I hand the controls over to you, Jean, just to let everybody know who is listening in today, if you have any questions throughout the presentation, feel free to type them into the question pane. We will go through those at the end of the presentation. So hopefully that will work for you, but I will go ahead and give you the controls to advance the slides, and then I'll go ahead and mute myself.
Very good. Thank you, Carrie. All right. Well, good morning, everyone. Let's get started with things here today. We've got a lot to talk about. There we are. And there we go. So here is our agenda for today. And it's a hefty agenda for a limited time period that we have here to talk about things. So I want to just acknowledge that we're not going to be able to go into real depth of some of these agenda items, but we will for sure give you some information about each of these areas. And what I just want to reassure everyone is that between ElderHelp and Alzheimer's San Diego, you folks have a variety of resources and supports at your hand, so that if you do have questions specific about these different agenda areas, please contact either of our organizations, and we will be able to talk with you and hopefully give you some answers and some guidance. So what we'll talk about here today is long-term care and really kind of understanding what does that really mean. And within long-term care, the variety of different options, which includes care that is provided in the home, the different types of adult day programs that are available in our communities, residential care, referring to the facilities that people go and live in and receive the care in the facility. Of course, with all of this, there needs to be financial considerations. These options are expensive, really, across the board. And there are financial considerations to be thinking about and to be looking at programs and supports that can assist with the financial end of things. And then what are the other resources and supports that are out there? So, come on. When I say come on, I'm talking to my computer. I hope all of you can appreciate that. So we'll start here with looking at the continuum of care. And when we're talking about long-term care, what we are really referring to is non-medical care, okay? So what we also call non-medical care, custodial care. And, you know, we get our medical care through our doctors, through our hospitals, urgent care, through our specialists, the other health professionals that we see. Where do we go to find our custodial or non-medical care? And, you know, specifically what is custodial care? So what we're talking about really is all of the services and supports and the programs that are out there in the community that provide non-medical assistance to people. And they provide this assistance with the basic activities of daily living, which I'll go into in a little bit more detail shortly here. So across the continuum of care, we have in-home care, adult day programs, then once again, that residential care, living in a facility. And at the other end, we have the spectrum, skilled nursing care. So that's just kind of encompassing some of the different supports. And understand too that when we talk about long-term care, we tend to think about that in kind of a, I'm going to say, a linear way. But meaning that, you know, maybe we start with in-home care and we end up with skilled nursing care at a later point in our lives. But the fact is, really, we can use these different types of care at any different point in our lives and in the lives of people we are providing care for. So it may be that a person uses some residential care for a brief period of time, while maybe a family member is away on some kind of important trip for a couple of weeks, and then we return home and have some care in the home, providing some assistance. So I just want to illustrate that, to encourage and remind everyone that we don't need to look at long-term care as being something that's very linear. Oops. So here we have, folks, the activities of daily living that custodial or non-medical care is providing assistance with. And that includes all of these different areas. That doesn't necessarily mean people need help in all of these areas. They may just need help in a couple of them. But what we are talking about is eating, and that's everything from making the food to actually physically eating it. We're talking about bathing, again, everything from kind of getting the shower ready and being able to get into the shower, wash one's hair, scrub scrub the body, towel dry, all of those different steps that we need to take when we are bathing. Same thing for dressing. I may be able to dress mostly completely on my own, but perhaps I need help with putting the shirt or the sweater on because I have limited mobility in my shoulders. Transferring, we're talking about transferring from a chair to a bed or vice versa, or to a toilet as well too. We have to consider that when we are using the toilet, we are transferring from a standing position to sitting on the toilet. And if I'm using a wheelchair, I may need to be then transferring from the wheelchair to standing and then to sitting on the toilet. And then with toileting, what we're talking about specifically is cleaning oneself, being able to use the toilet successfully, and then to be able to keep oneself clean. And then additionally, we can include in the activities of daily living mobility. So being able to walk or move around. If I need some assistance with that, I have some assistance with one of the activities of daily living. There we go. So I'm a little too quick with the changing the slides, and then it jumps ahead here. So here's an important conversation for all of us to have at some point in our lives if we live long enough. Is it time for more help? And how do we figure that out? What questions do we need to ask ourselves in order to figure that out? And so here are some of the things to be thinking about. If, as a care partner or a caregiver, you are having more and more difficulty managing all the different roles and responsibilities, and there are many, all of you folks know that, it may be time to bring in some more help. You think about all the different roles, all the different hats that a care partner wears. It's everything from being, a hands-on caregiver to the cook, making food, keeping the house clean, making appointments, doing laundry, managing finances, pardon me, getting people to doctor's appointments and other important appointments. And that is just a few little examples. There's many, many more things. There's other household maintenance that needs to be attended to, car maintenance, all sorts of other different roles and responsibilities. And if it is getting to be troublesome to kind of keep everything going, keep the household and daily life moving in a fairly fluid manner, in a fairly steady manner, then it's probably time to start thinking about bringing in some more help and supports. So if negative effects on a caregiver's health or well-being are occurring, that is something to pay attention to. If you're having trouble sleeping, not getting a good night's rest, I mean, look, nothing can happen and happen well if we're not well rested. We just can't do all of these other things and do them efficiently and do them well when we don't have, the physical capacity to do so. And we need that rest and able to think well and to operate efficiently in terms of our physical bodies. So if there's negative health effects going on, that is something to pay attention to. If there are challenging personality changes and behaviors occurring in the person that is being cared for, the person living with dementia, that requires a whole nother level of responsibility on a part of a care partner and can be very, very challenging, mentally fatiguing, emotionally draining, and sometimes physically draining as well too, because there's just this added element. And usually when we're talking about challenging behavior, It's usually things like resistance, for example. These are challenges that add to the stresses of the daily role of being a care partner. And so that may be time to bring in more help too. For sure, when there's increased care needs, just as a person is needing more and more hands-on care with bathing, with toileting, with getting, dressed, all of those different things that are requiring more physical effort, that may be a time also to think about bringing in more care. And then we have to think about the safety risks, which again is a very important role and responsibility for caregivers, and can become more complicated as there is disease progression. So difficulty preventing falls, injuries, or wandering. If you've got a person that you're caring for that you are kind of constantly having to monitor because they are looking for a way to go out the front door, that can make a day-to-day life much more challenging, for sure. So let's start talking about in-home care. And, what is in-home care? Who is providing the in-home care? And let's look at these different areas of care. So housekeeping, we're talking about keeping the home, in a reasonable state, reasonably clean, that we have clean dishes, that the bathroom's decent, vacuum, so forth. When we're talking about custodial care, again, we're talking about that non-medical care, and think back always to the activities of daily living, okay? And then we have medical services, which we're referring to when medication is administered to people. If they are diabetic and require injections, that is being done. If a person has an indwelling catheter to drain urine from the bladder, then that catheter requires some specific care as well too. So when we start at the top with family, friends, and other natural supports that are unpaid, we do all of these things, don't we? We cook the breakfast, we get the medications out for mom and give them to her. And, if she has a catheter and the bag needs to be changed or the catheter needs to be irrigated, that's what I do. And that's actually what I have done in the past too. And I'm sure many of you have as well. Now, when we take a jump down to licensed home health care providers, these are people that we bring in the home and they are paid. They don't do the first two items in this chart, the housekeeping and the custodial. What they are providing is medical care. And truly, you don't want them doing the housekeeping and the custodial because this particular level of care is very expensive. So you wouldn't want to be paying, XYZ dollars per hour to a person to clean the kitchen or vacuum. You want to reserve that level of financial commitment to the time that they are providing that medical service level of care. And then at the bottom, we have licensed home care providers. And so these are the agencies that you hire that provide you with a caregiver or perhaps two, depending on how many hours you're looking for coverage. And they can do housekeeping, and we'll quantify that by saying light housekeeping and meals. So these folks are not house cleaners, but they can tidy up the kitchen after making lunch for sure. And they can also provide that custodial care. And so provide the assistance in the shower, assistance with toileting, with dressing, again, referring to all those activities of daily living. So as family and friends, we do it all. Our licensed home health providers focus on the medical, and our licensed home care providers focus on providing assistance with the ADLs and minimal housekeeping. So hiring in home care. The Home Care Services Consumer Protection Act came into place in 2016, and it requires any of these home care organizations, the agencies that are out there here in California, to be licensed. And additionally, as a part of that licensing, the employees that they have within that agency, that would be the people who come into your home to provide care, have been background checked. There is appropriate workman's compensation insurance in place. All of some of these good business practices is part of what this Home Care Services Consumer Protection Act initiated and now provides the oversight for. Additionally, here in California, this particular act also created a public registry for people who advertise as home care aid employees, but are independent contractors. They don't work for an agency, but they do go through the background check, and this is the place where you can go to obtain the information on finding these particular people who are in the registry and who you can hire privately. Now, the average cost of this type of custodial non-medical care here in California as of 2021 was $33.50 an hour. And I suspect that that has gone up yet more because of the changes in our minimum wage, and also just with the pandemic and agencies having trouble. They're looking to hire more and more care providers to go into the home. And so it's been challenging to fill those positions. So the costs have gone up, and that means, of course, it's being passed on to consumers. So considerations in hiring an agency, these are some of the things we want you to think about. And you can contact, again, either ElderHelp or Alzheimer's San Diego, so that we can provide you actually with kind of a specific list of questions and considerations as you are looking at agencies. For sure, you want to know what the hiring and screening procedures are for these employees that they bring in and would be potentially assigning to come and work in your home with your person who's been diagnosed with dementia. What do they do? Are they looking for people with previous dementia experience? What is their kind of basic structure in terms of bringing a new employee in and then working to place that employee in an in-home care position with a family. You also want to be asking what services are and aren't provided, and this is important. Some agencies may provide transportation. In other words, that the caregiver may use their own vehicle to take your person who's been diagnosed with dementia to a doctor's appointment or to go grocery shopping. Other agencies perhaps don't do that, or they may have kind of an in-between where you as the family, the hiring family, provide the vehicle, the transportation, but the caregiver that you hire through the agency can be the driver. So you need to be very specific about what services are and aren't provided. And, in addition to this example I've just given you about driving, to find out who needs to cover the insurance for the driver, who is the caregiver. Is that you, the family, or does the agency provide that? It's also very important to ask what kind of dementia-specific training is provided to the employees. And I encourage everyone to get into the details of that, because it may be advertised on a website, or it may be stated to you that employees receive dementia-specific training, but what does that look like? Does that mean watching a couple of videos, short videos, 15 minutes in length, and then that is considered the training? What does it look like? Ask about the costs, and ask about all the costs. And so I'm thinking specifically, if you were, excuse me, to cancel a caregiver coming in at the last minute because of a change in family plans, are you still going to get billed for that shift? You want to be looking at, if you call at the last minute and say you need somebody to come over, is there going to be an additional charge because it is last minute? So ask about those kind of questions. Ask about scheduling policies and what that looks like. Excuse me. And how far out caregivers need to be scheduled. And then for sure ask also then about the after hours and emergency procedures. And again, going back to, let's say, a scenario where maybe a caregiver that's been hired through an agency doesn't show for a particular shift. What is the procedure? You call the agency and say, my caregiver didn't show? Do they have somebody answering the phone to take that call? Will they work to find somebody to replace that caregiver to be able to fill that shift? Ask those questions as to what's going to happen. Now, for more information in these areas, here are a couple of websites that are really, really good and very informative. And the top one is the California Department of Social Services. And this is their Home Care Services Bureau, the URL. And you'll get lots more information specific about this whole area of home care and the licensed agencies when you check this one out. And then once again, contact us at Alzheimer's San Diego, and we do maintain a resource list of local, non-medical, in-home care providers that do have dementia-specific experience. And so we can get that information to you, so you don't need to be Googling and trying to figure out, who do I call for this type of care that I'm looking for. We can get that to you right away. Let's talk about adult day programs. These programs are called all sorts of different things. They are also referred to as community-based adult services. And amongst professionals like Carrie and myself, you may hear us refer to that as CBAS. And so it's one of those funny acronyms that we start throwing around like everybody knows what we're talking about. But if you hear CBAS, we are talking about adult day programs. Now, not just many, all of these programs were closed during the pandemic, of course, but opened up and are continuing to do so in some different locations as well too. And I will just let you know, we also maintain a resource list of these programs at Alzheimer's San Diego. Now, what do these programs do? What do they provide? They provide a range of both recreational and sometimes therapeutic services in a safe and supportive environment, meaning it's monitored, it's supervised, it's controlled in terms of exit and entering, so that people, for example, living with a diagnosis of dementia that wander can be, in some of these programs, kept in a secure perimeter. These are non-residential programs, so they are usually kept, are open during normal business hours, which would be Monday to Friday. Those hours can range, however, everything from I've seen 7 a.m. to 6 p.m. I've seen others that maybe start at 10 a.m. through to 4 p.m. So the hours of operation can change, but it usually is Monday to Friday during daytime business hours. The different types of adult day programs are social programs. So these ones focus on the recreational part of the program. That's 100% what it is activities are being, led by staff, adult day staff, different types of activities, exercises, music, current events, maybe some crafts and art programs, might be doing some other things, some community service projects for other agencies. So it's all activity-based programming that's going on in the social programs. And obviously, the social part of it is the people who are attending the program interacting amongst themselves, but also having that facilitated by the activity staff. Adult day health programs have those social and recreational aspects as well. And in addition to that, they provide a range of therapeutic services, such as physical therapy. They may have an occupational therapist comes in to adjust or adjust wheelchairs or other devices that are being used for mobility. They may have also an RN, that a registered nurse, who will monitor blood pressure and can administer medication. So there's some therapeutic services that are also being provided there as well. Then there are some non-licensed older adult programs, and one or two of those that are available. These programs are, just as I say, they're not licensed by through our state government, but what they are providing is a social program for people to come and have some fun and do some activities with one another. And again, we can, through Alzheimer's San Diego, provide you with more information on all these different types of programs, what they are and where they are. Now I'm going to just say the benefits for these programs are many, and all of these things. The social engagement is tremendous. The cognitive stimulation through the facilitated activities. Yes, there's physical activity, nutrition and hydration, because you're eating together. It's a family meal kind of style of things, and that helps encourage people to eat and hydrate better. And for at least the adult day health programs, there is medication and healthcare monitoring, which is great. The safety and the supervision is there. And a couple of other things that are tremendously important is these programs keep people busy during the day. And that is going to help with better management of some of the behavioral issues we see in people with dementia, which can be agitation and a disrupted sleep cycle. So when folks aren't able to stay at home and kind of nap in the recliner or on the couch all day, when they're being kept busy in these day programs, they're going to sleep better at night. And having a better sleep-wake cycle is going to help reduce some of the agitation. And very important, these programs give caregivers a break. They give them some respite. And caregivers absolutely need that. And it needs to be part of the safety net planning for caregivers. So consider the benefits to everyone with the use of these adult day programs. How do you find one? Well, once again, give us a call at Alzheimer's San Diego, and we'll provide you with some lists. And some of the things that you need to be thinking about with regards to these types of programs are the level of activities and services that are provided. And again, do the staff have some specialized dementia training? And what does that look like? Where does this organization, this program, where do they get their dementia training from? You want to be asking about what the costs are, per day or per hour or whatever it might be, and what insurance coverage might be available. And when we're talking about insurance coverage, some of these programs will accept Medi-Cal. And so people who are on the Medi-Cal program, Medi-Cal will pay for the cost of the adult day program. And additionally, the VA, depending on the services that you have through the VA, can also pay for the costs of these programs. You want to ask about transportation options. These programs often within, a certain geographical range will provide transportation to and from the program. So you want to ask about that, and does that impact cost and add to it? And then you want to work with the staff to coordinate a visit or a trial day. And as far as that goes, what I will say is put your trust in the staff at the center as to how they're going to manage that. That's part of what they do on a regular daily basis, is, to make people feel welcome, to distract them away from the thought of, no, I want to go home, to get them engaged and involved. That's part of their day-to-day job. So put your trust in them to coordinate a trial day, to give it a try with your person living with dementia. And I'll just say, sometimes you might hear some negative feedback about the program from your person living with dementia, but I'll caution you that that doesn't always mean that it was a negative experience day for them. Sometimes they've had a really good, really fun and engaged day, but they're telling you, no, it wasn't so good. The average cost for this type of program per day, this is from 2021 prices, was about $95 a day. Some of these programs do offer half-day options as well. All right, let's delve into a little bit about residential care. And this little chart here kind of tells you a little bit about the continuum of residential care. And what we're going to focus on here today is residential care facilities for the elderly, which we call the RCFEs. And this includes board and cares. And board and cares are some of those small homes in the neighborhood. I've got one down, 2 houses down from me in my neighborhood, and some others as well. These are residential homes that are licensed and that provide care in that home for usually 4 to 6 residents. And we call them board and cares. Have the assisted living facilities. You may see these advertising a lot in the paper, the newspaper, if you read the daily newspaper. They're the ones who, as we drive around our own communities and neighborhoods, you'll see signs for them. Building will be on the corner of some streets and advertising as assisted living. And that's for, people that then are moving into that particular facility and are getting just what the words say, some assistance with daily living. And it might be just a little bit of assistance, or it might be a bit more. And also with assisted living, we have dementia and memory care. And so this is a step up from the assisted living. It is a residential care environment and staffing level that is focused on providing care for people with a diagnosis of some type of dementia. So what is it? What is memory care? Well, it is specialized, and it is licensed by the Department of Social Services. And there are additional requirements for memory care that are the licensing requirements that must be met. And that includes that they must have a secured perimeter. They call it a delayed egress. And this is because we know people with dementia wander. And so the perimeter needs to be secured. And so it's often a little code that as a family member you will have available to you, and that the staff members do as well too. But you know, the door fairly quickly closes and then is locked, and then the residents that are in that memory care are not able to go out through the exit to wander away. The staff that are positioned in memory care programs or facilities have additional training that is required of them in dementia. So they have additional training as they are brought on as new employees in skills related to working with people with dementia. And also they are required to have ongoing training on an annual basis to keep their dementia skills, you know, good and up to date, and to be able to best serve the residents that are living in the memory care. They have structured schedules and some specialized activity programs. What we know about people living with dementia is they do well with structure and with routine. And so that is something that you will find in these memory care programs. And the times are very specific, keeping in mind that, again, a person living with dementia has a shorter attention span. So to have an hour-long program might be too much, unless maybe it's a music-based program. Shorter programs are better, so the structure and the specialized activities are very important for the residents that are living in memory care. Go for me again. Evaluating. This is just a kind of a brief overview of the different things that we want you to be thinking about with regards to residential care. And again, if you contact us at Alzheimer San Diego, we can provide you with this list and with additional information and direction to websites where you can get some really good questions to arm yourself with when you are beginning to look at residential care, memory care for the person you are caring for. Because it does take, you know, it takes some work to identify the memory care facility that is best suited for your person living with dementia, but also best suited to you and your family based on all the different things we need to think about. And so this is just a brief overview. I'm not going to go into details with all of them, but it's everything from, you know, what does it cost? Finances plays a role in all of our lives. We all have budgets. To, you know, the facility itself, the staff training and engagement, what are their other supports, all of these things. And, you know, you'll see in the bottom highlighted is what is most important to you. And you have to start thinking about that a little bit and start writing some things down about what is important to you. But I'll tell you one thing that I have learned over the course of my years, my career, and after having worked in memory care too, is the prettiest place, you know, that has all the design bells and whistles isn't necessarily the best place from my perspective professionally and having worked in memory care, the area that I am most focused on is the quality of the care. The best facility, to my view, and this is information that I talk about with families, is the one that takes the best care of the residents that live there. And this is from everyone, all members of staff, regardless of what your position is, whether you're in housekeeping or in dietary, if you are a hands-on care provider or an activity director, or if you're in maintenance, you know, it doesn't matter who you are. The quality of care, the way you interact with the residents who live there, that's the key. So for more information, here's some great websites for you to go to. Again, California Department of Social Services. And you see the URL there. You can get some good information about the facilities that are licensed and begin kind of pulling together that information. Another really good website is choosewellsandiego.org. And this website focuses on assisted living facilities here in San Diego County. And you have the ability to look up all sorts of different information on those facilities and do some comparing of one facility to another. The New Lifestyles magazine has a comprehensive listing of residential care facilities. And so that's a good place to go to get some basic information. Understand, though, that it is advertisement supported directory, meaning, you know, if you see the big ad for a particular XYZ facility, it's because they paid for that ad. It's not because New Lifestyles is saying these guys are the best. Come to us again, Alzheimer's San Diego, for a list of the local residential dementia and memory care communities. We've got a good list. We've got it arranged geographically for the County of San Diego. And then we've got this checklist for evaluating memory care. So some good resources for you. So how do you pay for all these things? Well, the most important thing for all of you to know is Medicare and other forms of traditional health insurance do not cover the costs of long-term care. And every time I say that, it surprises somebody. And so know that right from the start. Medicare does not cover these costs, these programs that we've been talking about, these different types of care. So how is it paid for? A lot of it is paid out of our own pockets. So it's our own personal savings and assets. For many of us here in California and in San Diego, where some of our biggest assets might be our home. And so we look at leveraging the value of our home as something to be used in the future to pay for the costs of care. Some people have long-term care insurance. If you are one of these people, good for you. Long-term care insurance is something that is still available. It is like other forms of insurance. It's a policy that you buy and pay for. There are restrictions on who can get the policies. If you are older with multiple health issues going on, and if you have received a diagnosis of some type of dementia already, you're not going to be able to get a policy. So these are policies that are best purchased when you are younger, maybe in your 40s and healthy, with a view to using that policy to pay for the cost of care when you get older and perhaps develop dementia. There are financial tools that are available to us. I referenced our homes being our assets. So reverse mortgages are a way to tap into the equity of our homes and use that to pay for the cost of care. There are charitable gift annuities that you can set up with different organizations to be receiving maybe a lump sum of money or a annual payment or whatever it might be in exchange for gifting for example, your home to a charity of some sort. And there is converted life insurance. So this is where you can access some of what you have paid into with your life insurance to change it. Well, it's letting you access the cash value of the policy is basically what that is doing. Certainly some financial advisors can provide you with specific and accurate information regarding these financial tools. And again, that is a resource that we keep, a list that we keep at Alzheimer's San Diego to put you in touch with some of those people. Lastly, and importantly, there's the benefits of Medicaid or Medi-Cal here in California. And there are VA benefits. So let's just talk about those. So Medicaid is what it is known by through other states, but we call it Medi-Cal here in California. And it is funded jointly with both state and federal funds. It is a need-based program, okay? And each state, how it is structured and administered is done differently. And what we will say is there tends to be a belief that Medi-Cal, because it is a needs-based program, that Medi-Cal is only for people who really have very limited income and you know, maybe no assets whatsoever. The truth of it really, though, is that Medi-Cal is a program for middle-class people like you and me, as well as for people with lower income. And it is a program that it really helps us so that we don't become destitute in paying for long-term care. So it is a program that can be of great assistance to people that are middle class. And you can qualify for Medi-Cal and still have things like owning a home and owning a car and having a certain amount of money in retirement savings. So it's important to get into the details of things with Medi-Cal when you are looking ahead at long-term care and looking at finances and saying, oh my gosh, how are we going to do all of this? Some of the programs available through Medi-Cal that can pay for some of the costs of long-term care that we've been talking about are in-home supportive services, and that is through San Diego County, and we can get you information on that program and the numbers to call. And then Medi-Cal can also pay for some of those adult day programs or the CBAS, the community-based adult service programs that we talked about. And so between those two things, that can be a good amount of care that is being provided, that is being funded through Medi-Cal. We also have veterans benefits, and I want to specifically mention a couple of programs with the veterans benefits. Now, for sure, veterans benefits provides health insurance for medical care, and it provides some income that is disability income that is service related. And then there's the pension benefits through the VA, which is just the traditional pension benefits. But an important program to be aware of is the non-service connected program called Aid and Attendance. And so Aid and Attendance, I want to just give you a brief overview on that. And I'll be honest, I'm looking at my cheat sheet here a little bit because I need to make sure I say things correct. Aid and attendance is for veterans and or their spouses, and it is people who need a little bit of extra financial help to pay for in-home care or assisted living, you know, in a memory care. It is non-service connected benefit. And the people who are eligible are people who are were discharged under conditions that were not dishonorable, so, and that they served 90 days of continuous military service with at least one day during during wartime, during World War I, World War II, the Korean War, Vietnam, or the Persian Gulf War. And again, I'm just going to say that the person served continuous military service for 90 days with at least one day during those wartime periods. Now, that doesn't mean you had to be serving in wartime active duty. You could be doing any kind of military service, not necessarily active duty. So just be aware of that. So this particular program can really bump up the financial resources that are available to families through aid and attendance that then can be used for these different types of care options that we've been talking about here today. Now, the VA Caregiver Support Program is also a really, really terrific program. And there is the URL to look that up on the website. And this support program, these support programs provide adult financial resource to pay for adult day health care. They can provide a homemaker and health aid that comes in the home to provide assistance. And it also provides financial assistance with temporary placement, respite. So again, maybe a stay in a memory care facility for a couple of weeks while a caregiver takes a trip to see the grandchildren, or maybe has to have a surgery and then have some time recovering from that. So some really great benefits through the VA. So starting the conversation that's where you begin. And starting the conversation means getting the right people to the table. And who are the right people? Well, that's all, you know, the decision makers for sure, whoever has power of attorney for healthcare decision making and for financial and assets. But then also just the safety net, the support system that is in place. So that may be children, adult children, maybe siblings, healthcare professionals that are working with you, the doctor, primary care physician. That may be then also the your accountant, your CPA, maybe your elder law attorney that you work with. All of those different people that have an important role in the support system for your partner and for the person living with the diagnosis of dementia. Those are the people that you want to have at the table and get input and information from. Start exploring options before there is a need. And I can't stress this enough, folks. Too many times at Alzheimer's San Diego, we get calls from families who are in a crisis situation and needing to find placement in a memory care facility today, now. And, you know, it can be done, but it's a tremendously stressful experience for all. And we don't want any of the families we work with to have to deal with that level of stress and anxiety. So start looking at the options before there is a need. Assess the finances. You can't make decisions about using this care option or that care option so you have a good picture of the finances. And then connect to the local resources, which is us, which is ElderHelp, and which is other organizations too, like the ones we've been talking about, the VA, Medi-Cal, some of those other different resources that are available to people. So that's us at Alzheimer's San Diego. We do a whole bunch of different things. We have our team of clinical care coaches available Monday through Friday, answering the phones 8:30 to 5. Pick up the phone and give us a call, and you can talk to any one of those folks on our clinical services team and get your questions, ask your questions, get resource lists sent out to you, and so forth. We have support groups, both virtual and starting now in person again, and over 30 of them, 33 I think. Online education and training is ongoing. We have a webinar library on our website. You can watch some of our other classes and programs. We have a volunteer tech team that assists with some of the platforms that we use, such as Zoom and this particular one. I can't remember what this particular platform is called. Carrie will tell me. GoToWebinar. We have social activities and outings for people who've been diagnosed with dementia and their care partners. These are in person, but with social distancing taking place. We support local research. We have a volunteer-based respite companion program where we match up volunteers to families to spend some time with the person living with dementia as a companion. Vitals is for people who are living alone in the community with a diagnosis of some type of dementia, and we have volunteers to stay in touch with them. So that's all the different things that we do. You see our website listed there and our phone number. And so now I'm going to wrap up so we have some time for questions. Lots of information in a short period of time. Care options is complex and complicated. It takes time and very intentional thought to kind of delve into things, figure out what's going to work for you as a family, and based on the resources that you have available. Let's see, do you have some questions for me?
Well, thank you so much, Jean. I know that was a lot of information. You shared a really comprehensive overview of all of the different options. So thank you for your time. And I will go to the questions. It looks like I'm having some feedback, so I don't know if maybe you want to mute while I go through the questions.
Sure can.
Okay. Sounds good, just to see if that helps a little bit. So I know that there was a question that came earlier on about if you'll get a copy of the slides, and yes, so all of you will receive a link to the recorded version of this webinar so that you can watch it if you missed part of it, or if you didn't, if you wanted to focus in again on a particular area. You'll all have access to that, as well as we will share a PDF version of the slides so that you can go back to some of those websites that were shared during the presentation. So hopefully that's helpful. Let's see what questions. Okay, so coming to a question about the organizations that you shared, I think earlier on, the question is about how the organizations support early onset Alzheimer's versus later in life, but I'm not 100% sure what organizations that person was referring to. So I don't know if that was earlier in the presentation, so it was probably not yet about adult day, but maybe it was about home care.
So, well, here's what I can tell you is, well, I'll say this. Can we get some clarification? Are we talking about early stage Alzheimer's disease or younger onset Alzheimer's disease? So younger onset meaning at an age 65 or younger, early stage being early in the disease process.
Okay, and I got some clarification. Thank you for adding that in. So she was actually referring to our two organizations, ElderHelp and Alzheimer's San Diego. So I know I can speak briefly about ElderHelp, and then Jean can share about Alzheimer's San Diego. But through ElderHelp and our programs, we're really working directly with the individual who wants to maintain their independence and continue living at home. So when they get to a certain point where they're no longer able to do that safely on their own, that's usually when we bring in outside resources and other support. But I will give you a little teaser that we are working on another partnership with Alzheimer's San Diego that will be assisting individuals who are living alone through the Vitals program a little bit more, even with a diagnosis of dementia. So there is some crossover with that, but we typically are referring and getting additional support in when needed for those individuals.
And as far as Alzheimer's San Diego goes, we have some different programs and supports for people that are newly diagnosed, so who are, don't need some of these care options at this point in time, but need other types of supports. And we do have some of those. We, at one point, we did have actually a support group for diagnosed individuals in the early stage. During the pandemic, that of course was shut down, and we haven't gone back to in-person for that particular program, but it will happen. And then, we've got a variety of other, our social activities program is really, it's for anybody with a diagnosis of dementia who wants to participate in some of these social programs, whether you're early on in the disease process or later on in the disease process. So and for people who, I'm hesitating because, it's really, it's dependent on what people are looking for. And if we don't have what people are looking for, we do go to other, we refer to other organizations that provide services different from ours, different programs, and so forth. The end goal being is we want families to get the supports that they are needing. So I don't know if that's helping. Does that really answer the question?
I think it shows the spectrum, of people who are just starting in the disease process and who are further along. So I think so. I'll follow up and see if there's any other from her. But there is another question about the assisted living conversation, and that it can often be challenging to get a budget together when somebody is looking at that as an option, because there are so many varying costs based on the levels of assistance that are needed. So it can be difficult to budget, if they add meals, if they have a breakout for all of the individual ADLs that you might need assistance with. So if you have any thoughts or any support about how to handle that conversation and get that process started so that they can budget.
Yeah, generally what we would do there is refer people to some of the estate planning attorneys and going to potentially our legal and financial basics class, which is actually, we have a recorded version in our webinar library so that you can talk to the experts there or listen to the experts there is the best plan. For sure, the assisted livings, it's kind of, we call it boutique pricing, because you get your base price, and yes, then kind of the more assistance you need, the higher costs go. There's incontinence care included in that. There's all sorts of add-ons in terms of costs and prices. If you're looking at facilities, this is when you want to ask those questions about all those specific add-ons, because you might be getting a number from the assisted living that says, oh, the cost is going to be $5,500 a month. But if your person needs a higher level of care in later stages of the disease with incontinence care and maybe, you know, just more assistance, you might be looking at a cost of $10,000 a month, which that's a big difference. And so it's really important to really just be armed with good knowledge ahead of time to ask those very specific questions of facilities.
Yeah, I think those are good suggestions. There is a question about if we can help to clarify the different types of the community-based adult day centers or CBAS programs. And then that same person is asking about any who can help figure out Medi-Cal eligibility. So I kind of see those as a little bit combined.
Well, the adult day programs there's really basically three types. And there's the adult social day programs, which is just that, they're social programs, okay? And these are going to be private pay out of pocket. Medi-Cal doesn't cover the cost of the adult social day programs. There are some very affordable ones out there, though, that are really terrific. Then there is the adult day health programs. This is the ones that we also will refer to as CBAS. And these are the ones that Medi-Cal can help pay for the costs of. And in addition to Medi-Cal, the VA can help pay for the cost of. These are the programs that provide the social programming, but also have that health medical aspect to it. So they have the ancillary services of occupational therapy, physiotherapy. They can administer medications. They can assist people in the bathroom with toileting. They can take blood pressure. So it's like the social programs plus health. And again, that Medi-Cal and the VA are two programs that can help pay for the cost of those. And then the third option is the older adult programs that are non-licensed and they have a social focus. And again, there's just one or two of those here in San Diego, and those would be private pay out of pocket. So that's kind of the brief description of the adult day programs. Now, as far as Medi-Cal eligibility, again, what we refer people to is to watch our webinar on legal and financial basics, because it is provided by a elder law attorney, is the lecturer, the presenter, with a big focus on Medi-Cal planning. And then additionally, we can send you that resource list of the elder law attorneys. And these are attorneys that work with our organization. And if you tell them you were referred by Alzheimer's San Diego, you will be able to have a no-cost phone call with the attorney for up to 1 hour to begin the conversation about Medi-Cal planning. And then whether you choose to engage with that attorney or not, then that would be up to you, and you would be paying for their time. But they are the experts in terms of Medi-Cal planning.
Wonderful. Thank you. Well, I want to be respectful of everybody's time. We're at the end. So again, Jean, I really appreciate you joining today and sharing your expertise with all of us. And if for some reason we didn't get to your question, we'll follow up and help to guide you through that. And as I mentioned before, you'll all be receiving a recording of this webinar as well as a copy of the slides for your reference. So we thank you so much for joining today, and we will be in touch with our follow-up shortly. So thank you so much, and take care.
All right. Thanks, everyone. Thanks, Carrie. Bye.